All right, we're on your side with health news now. As we told you earlier in the show, actress Angelina Jolie revealing today that she had a voluntary double mastectomy after learning that she carried a deadly BRCA gene. Now, for more on that gene and the risk of developing cancer, we are joined by our local medical expert, Dr. Dave. Now, let me understand this. We all carry this gene that helps us fight off cancer. Some people have a defect in that gene, and that's what happened to Angelina Jolie?
That's right, Mike. The BRCA1 and 2 genes are tumor suppressor genes that, when working normally, prevent cancers, but when they're defective, they can increase a person's risk for developing cancers. Breast and ovarian cancer in women and testicular and prostate cancer in men who have the defective gene.
Now, Angelina Jolie lost her mother to ovarian cancer.
That's right, Mike.
So she knew this was in her family.
Right.
She knew she had this defect in her gene. So she made the voluntary decision to get a double mastectomy.
That's right. That's one of the options for women who are tested positive for the BRCA1 gene, is to undergo mastectomy to reduce their risk of breast cancer. There are other options they have as well.
So is this something that you can be tested for other types of cancer as well? Should people that have cancer in their family be tested?
Well, usually a person goes to see a genetic counselor by referral from a doctor because they have multiple family members with certain types of cancer, or because they have a certain history or multiple histories of cancers themselves.
I was just asking you, when a huge star like Angelina Jolie comes out with, honestly talking about this, you as a doctor, do you find that your patients are more willing to come to you and say, let's talk about this?
Absolutely, Mike. I think it's great when a celebrity sheds light on any kind of health problem, because it makes patients more aware of the health problem and more willing to communicate with their doctors.
And you have to give Brad Pitt a lot of credit. He stood by her through this whole thing. How important is that when a patient has a diagnosis or has a huge decision to make like this?
It's very critical to have family support to go through this diagnosis and the stresses that are involved in going through a diagnosis and treatment like this.
Right.
How accurate are these tests usually? When you get a reading back that 87%, they're pretty accurate? You can trust those results?
Well, Jenny, the BRCA1 and 2 mutations are not very common. Most people in the population don't have that mutation, and people who have the mutation are not always going to develop breast and ovarian cancer. So a genetic counselor can tell you if you have the mutation and whether or not what your specific risk is.
All right. Dr. Dave, thank you so much. Dr. Dave was going to talk about something else today, but when the story broke, we decided to, we had to address this. So thank you very much for doing that on short notice. Yeah, very good information today. Dr. Dave does join us every Tuesday here on the Noon Show. If you have a question or a topic idea for her, just email it to us at newsdesk@cbs47.tv.